Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation During the COVID-19 Pandemic. I am joined by Dr. Suraiya Rahman and Dr. Cynthia Stotts, both from the Department of Pediatrics at LAC-USC. Today, we're going to be talking about many different things, but specifically how pediatrics and parenting has changed during this time. Some tips that parents can use to navigate this uncertain time during the pandemic, and to explore the debate about reopening and closures of schools. So, Dr. Rahman, can you tell us a little bit about yourself?
Sure. I'm a pediatric hospitalist, which means that I see patients who are admitted to LA County Pediatrics along with Dr. Stotts, and we serve a very diverse and underserved population. And so from that perspective, I'm also a medical educator, educating residents and medical students in the best practices and the experience of taking care of this population.
And thank you. And Dr. Stotts, can you tell us a little bit about your history?
Yes, I actually came as a family medicine rotating intern and loved it so much I decided to do 2 internships. And I did med peds and then stayed on as a peds chief and then allergy immunology fellowship with Dr. Rahman. Fell in love with inpatient pediatrics, the ICU and the wards. And that's where I found my feet. And it took me back there at the end of clinic or at the end of whatever I was doing to see how is that kid doing. And so my heart followed my feet.
Well, thank you for sharing. Both of you are obviously very much involved in your pediatrics department. What do you think are the biggest changes that you've seen as a result of the pandemic with your patients?
The decrease in the number of interactions that a patient has with their pediatrician. You know, the opportunities that a pediatrician has to intervene with a patient and their family is something that we're kind of seeing globally go down. You know, that one, we are moving to telemedicine, but it's not the same. There's not that relationship building that you can get. So definitely we're seeing a difference in that.
Pediatricians love to teach and we love to interact with the family as well as the child. And so it's the joy of developmentally talking with or speaking to kids at the age that they're going to understand it. And that's part of the fun of pediatrics. But then also, you know, talking with a family, you know, in an adult level. And that has been disrupted. Families are not able to come into the hospital if any of the family has COVID positive disease or if they're in quarantine. And we're including children who are, you know, on ventilators and deathly ill. Families are not able to come up and be at the bedside. It has had a profound effect on the way that pediatricians function and actually the way that families can heal because they're getting disrupted and they're not even able to support each other or console each other and you know, which is an incredibly important part of the pediatric recovery is having the family present. So this has been a very, very, very big change in the way that we're seeing different patients and that we're caring for patients and their families.
That you make a lot of good points, right? In pediatrics, your patient is the child, but the family, you take them all under your care. And you touched on about the kids being really sick, and you have some really sick kids in the hospital. Can you talk about this idea of can children get COVID and are they able to spread COVID?
Yeah, for sure, children can get COVID. That's the short answer to that. And they can also spread it. Just to bust any myths that people might have, I think one of the reasons that we point to the numbers of children, you know, with less tests coming back positive for children is because initially when the lockdowns happened and in that first wave, schools were shut down pretty quickly. And so children were already sequestered from their area where they were most likely to get infected, which would be in school. And so I'm afraid that we are going to get a truer, prevalence data for children as schools start to open up more, and we're seeing some of that, already start to play out in daycares and things like that.
I would say there's two categories of can children get sick, and yes, they can get the acute type of COVID that we're used to on the news, where they could either have a mild URI or, even be have no symptoms at all. They can get moderately ill where they need to be, in the hospital because they're not eating or they're not breathing well. And then they get what would literally be deathly ill and do die or come very close, to dying. And so this virus is, it's a virus that we all have learned to respect and that we really can't predict. We have to, go along with the symptoms that are presenting in the acute stage. There's the recovery stage of somebody who has had COVID and how it makes them feel. And we're all going to learn about that over our lifetimes, about the effects on immune cells and on memory and, how it actually is going to affect every organ, but, just globally in an integrated fashion. But then we also have another category for children that's special to children, which is a multiple inflammatory syndrome of adults, but it's also a multiple inflammatory syndrome of children. And this is a response to the virus. It usually occurs a month or so later, and they almost look like a Kawasaki disease-like. There are a number of bacteria, strep bacteria, staph bacteria, mycoplasma bacteria, and some viruses, CMV and HIV are viruses. And these are common known infectious etiologies that will stimulate the immune system to become overregulated. Mm-hmm. And they can actually come in looking like they're in shock and requiring to go onto a breathing machine and blood pressure medicines to support them. They can have their skin slough. They can have their eyes turn red. They can have coronary changes within their heart. And COVID is doing something similar, not exactly the same as Kawasaki's, but similar in that it's stimulating the immune system to become overactive and unregulated. And so now we have a category of, if you have a fever and you have a fever for an unknown reason and you have a fever for a number of days, 4 or 5 days, we have now added this MIS-C, the multi-inflammatory syndrome of children, into the concerns that pediatricians are now looking at to see if we can detect that and then give medications, if it's present. But this virus has a lot of unknowns to it, and it has garnered full respect from pediatricians.
So one of the secondary effects for sure, in addition to that, is, as children miss their vaccinations, for example, over the course of the next year, and it's already started, we will see a resurgence of other diseases, other childhood diseases that, like whooping cough, and meningitis and pneumonia and things like that were much better controlled with better vaccination. So our vaccination rates are not going to be as high as they were in the community. And so we're going to have all of that play out as well over the next year. When it comes to the COVID effects on children, this is the secondary COVID effects on children.
Can you talk a little bit more about that, about the vaccinations specifically? Why have you seen a decline, and what do you think might be a solution?
Well, generally, it just has to do with access. There's fear of coming to the hospital. There's fear of going outside of your home, especially with multiple children, especially if you're taking public transportation, especially if you, rely on, public assistance and things like that. It's just this added stressor so that vaccinations kind of fall off the menu. And I think the thing that can be done about this is programs to, tighten up more vaccination, to even, and we do that over there, over at LA County, as well as every encounter we have with a child, we always check their vaccination, and then we bring them up to date. So, at the simplest level, it's as simple as every time a provider comes across a child, let's say for this winter, ask about their flu shot at the minimum, and refer them onwards for further vaccination if they've been delayed. And reassuring parents and giving them the knowledge to do so safely is another thing that we can do as pediatricians, is to decrease the fear level and increase the comfort level in how to go ahead and get the regular care you need, but how to do it safely.
I have to echo, Dr. Rahman's comments. I lived and was an intern before we had the pneumovax vaccine and the pneumococcal vaccines that dealt with strep infections and Haemophilus influenza infections. And I saw children with meningitis, bacterial meningitis, because they did not have the vaccine at that time against the streptococcus bacteria. And they would come in, their parents holding them, and in 12 hours they would be dead.
Oh my goodness.
And I lived that epidemic. We lived the epidemic of measles and all the complications of measles. And we lived the epidemic of Haemophilus influenza. And it is something that, one who has seen it can never let those images go. And you do everything you can to prevent any other human being from having to relive or learn a lesson the hard way. And so I think out of sight, out of mind is not helpful to us right now. And that it's essential that we get vaccinations.
Can we talk a little bit about masks? Sometimes you see kids and the parents are wearing masks, but the kids aren't. And then the thought of masks can be scary for children. Can children reliably wear masks? Can you maybe give us your thoughts about these questions?
Face masks are, the hot topic right now. So they are definitely recommended, for prevention. They can be effective in decreasing transmission. Healthychildren.org and the AAP recommends it for over 2 years of age. And the things to do for when you are thinking about, let's say if we were to sit across from each other and you said, oh, tell me how to put a mask for my child. One of the things would be to, make sure it fits right. If they seem to be struggling with it and touching their face all the time, that's also not good, right? So that's one key thing, is to try out different things, see what the child will tolerate, because you want to have something that the child will tolerate versus like, the biggest mask possible, and the child would just continue to play with it and touch their face. When it comes to acclimatizing it, lots of different suggestions is to decorate them, try to acclimatize the child to being able to see, like, let's say sit in the mirror and be like, oh, look, this is funny, make a game out of it maybe, or depending on the child's developmental level, and also to know that when is it okay to have off and when do you really need to have it on, right? So you can really be very consistent in the rules. So if the adults can get more clear about the rules, like if you're outdoors and you're with your family and the child is just running around and there's really no one around, just take the mask off. That's okay.
Mm-hmm.
But if you're going to go indoors and there's going to be more people, teach the child to be aware and say, okay, this is when we put our masks on. And children will emulate what their parents do. So as long as we keep those rules consistent, then children will get used to it, that's what I would say for that.
The one good thing about this COVID is that it doesn't jump. It doesn't jump in and of itself. It
Mm-hmm.
requires one human to share, vapors or spittle or whatever to go to another human being and have them either inhale it or, touch it on their hands and then put it in their mouth. And so there are lots of opportunities that we have to interrupt that cycle, because physical distancing, will work. Now, if you're going to walk and sit in a place where somebody was just sitting, you've moved into their 6 feet. Do you know what I mean? But if you're outdoors and things are dispersed, like Dr. Rahman was saying, then it's not going to jump onto you. And so knowing the life cycle of the virus really affords us great opportunity to interrupt it and to protect ourselves and our children. But it does require the concept of distance. And so if one person holds out their hand and another person holds out their hand and you can touch the other person, you're too close.
So, well, what about for our adolescents? I can imagine it'd be really difficult for kids and trying to figure out the masks. But okay, now we've bedazzled the masks and we've got the arm distance going, and now we have our adolescents who are missing their friends and are wanting to hang out. What should parents do? What kind of tips might you have for them?
So yeah, this whole pandemic, I've been operating as a pediatrician, but also as a parent. And we've really had to pay attention to certain things. So I can kind of give my lessons learned is with teens, it seems that communication would be the bedrock. So even approaching the teen as saying, this is a new situation. We need to work on this together. What are some of the things you need to make your life manageable and to replace some of the things that you're missing in your life? And how can we work together to achieve that, with this correlation, with this kind of like understanding that however we do it, we have to, one, be, flexible. We also have to be very aware of the realities, and also how to troubleshoot when you're out there. So my daughter has gone for picnics and to a park and taken her own blanket with her and taken whatever she needed. And her friends also came with food for themselves. And we reinforce what we expect to happen, knowing that obviously it's not going to be perfect. And that there's this kind of like risk benefit. It's like, okay, the benefit of this kind of gathering is that she gets this, social interaction that is so critical to her regular growth and development, but also that she realizes that it is a risk that everybody poses to themselves. So, have you checked in with your friends, made sure that nobody around them is sick? Are they doing a good job? So if you're going to be sharing a space with somebody and they're your friend, you can ask them like, hey, how are you doing? And if there's somebody who says, no, I'm not going to wear a mask, or is kind of flouting the rules, that they're putting you in danger, but also themselves and everybody else. And feeling empowered and empowering the teen to say, if there's a situation like that, you should leave. Our limiting screen time has been probably the biggest challenge for parents, and we're all failing at it. I don't believe any of us is doing a good job. So I won't be the pediatrician that pretends that I've got it all solved. No.
We're all doing the best we can, but kind of be mindful that there are safer ways of interacting with one another, and we should try to be as safe as possible, essentially.
Yeah.
And you mentioned a lot about development and the importance of development, which happens during the school age time and the interaction with peers. How do you think parents can compensate while schools are closed?
They're all going through the same thing. So there's nobody on this planet who's, jumping. Right, we're all in the same boat here. And there's lessons there, right? Is when we're all in the same boat, having our children think about other people and their needs. If we're comfortable and we have everything and all of our basic needs met, how can we help other people who struggle with that? Can be something that can really help our young people to evolve into empathic beings, and when it comes to development, that's what we want. As long as a person can grow up to consider other people's needs, and be aware of themselves as a person in the world, and feel connected to other people and supported and really discover their strengths. I mean, that's the goals of development overall. So I do think that there's a lot of positives here if we see them and if we support them. And children are vastly resilient. At the end of a tough day, it's my children who fix me.
There's so much back and forth about this idea of school, and the recommendations and what people are saying changes day to day. And the CDC director, Dr. Robert Redfield himself, said that he would absolutely send his grandchildren to school in the fall. And then the schools close. So, I mean, it's such a back and forth, and parents are just struggling with that. What do you think? Is it possible to make schools safe, and where do we go from here?
Well, let me give a little bit of a try here.
Good.
I think we need to recognize when you're safe and when you're not safe. And whether that's at school or in the store, or whether you're running for your ball, at the edge of the park and it gets to the street and then you have to stop. I think you have to have situational awareness at all times. Mm-hmm. Administrators have the duty to make sure that these simple fundamental principles of social distancing, masking, hand hygiene are upheld, and they need to be upheld at school. And so the question is, can they do that at school? Does school have the ability to have kids walk one way in a hallway instead of two ways? Do they have classrooms where they can have the chairs, separated, appropriately? And every school is going to be trying to do that. But it also makes a difference on the positivity rate, how much of the virus is in the community. And schools in where the positivity rate is high are shut down because there's too much virus in the community to expose the children. And even if the children do not have the worst outcome with COVID that we know of on an acute process or an acute phase, they can shed to others who may not survive and may die. And families who have had, we've taken care of children whose father had a cold on one day and was dead 4 days later, and now is being removed from the home, and they're now in our hospital, in crisis. So this virus, again, we respect this virus. And I think that school administrators are doing, their job in trying to determine whether they should be open or not, based on positivity. The CDC and the American Academy of Pediatrics did not put a positivity rate. They just said low density or no transmission or high transmission. One person who was brave enough to say something was Dr. Scott Gottlieb, who's the former director of the Food and Drug Administration, suggested that schools be very cautious when the positivity rate in their community is in that 5 to 10%. That's a very iffy, and certainly greater than 10% is a problem, considered to be a hot spot, higher out of control area. But those were not endorsed by, national societies or by the CDC. Just so folks understand, Los Angeles's positivity rate is 10% right now. In California, the positivity rate is 7.5%. In Miami, or in Florida, it's 18%. And in Mississippi, it's 23%. So there's a lot of virus in different areas. So I don't think that, anybody can say, can schools be open? I think everybody has to say, is it safe for my school? Can my school be safe? Is the community safe? We have to go through these checklists of safety like pilots go through. And then if you get to the end of the checklist and your child is in there, and, schools are also doing looking at additional thing of cohorting in pods, and Dr. Rahman did a beautiful job of describing who her kids could interact with. And if there's one child who's showing risky behavior, then that's not a good pod mate. Do you know what I mean? So having the cohorting in the smaller pods, so that if somebody does get sick, you're not taking out the entire school, you're taking out a pod. So these are some of the things, and I think we just have to look and see, do I see safety when I see it? If I do, I'm okay. It's not a virus that has the highest level of transmission. We really can control it. In countries who have controlled the virus, there are no deaths, for weeks to months in many countries, or the rate is like so slow as to be, handfuls in large countries. Seriously, this can be done. This
Right.
seriously can be done, but it can't be done in the way that we're doing it, because we'll just propagate the virus forever, because it's just a stupid virus. So it is achievable. We will, we do have the tools, simple tools: social distancing, masking, and hand washing. These are pretty fundamental principles that everybody can conceptually understand and can do for the most part, and can anticipate, is it safe for me to do these or not? And that's, I think, how people have to approach schools.
It's a great big experiment that we're endeavoring to perform, and some school districts are able to, for whatever reason, negotiate their way out of that experiment or stay behind. And there's some school districts that are going to go forward because they have a higher number of parents who need that school for daycare because they can't go to school and go to work. They don't have family, that whole like resource and that network to support their children in online learning. So the inequities within our system of schooling is being revealed in very stark terms, and our ability to navigate this really is going to be very difficult, I think. I mean, imagine being the child who's in the middle of an outbreak and their teacher gets sick and goes to the hospital. I mean, that is a traumatic experience for any child to have to go through, And what we're saying is that we're going to try and not have that happen, but the Major League Baseball was unable to do that this week. So, and they're hugely resourced.
Yeah.
In ways that the schools are not. So I do think I have a great amount of trepidation about this, and there's a lot more work that needs to be done. And the administrators are, unfortunately, every day, every week, they're writing different guidelines. They're trying to make sense of this, and that's not their job. Their job is to educate our children, and then we also have to think about how much of that is going to happen in these face-to-face schools. And all we're ever dealing with is keeping people safe and making sure the masks don't come off and this and that. Like, how is anybody going to pay attention? So it gets down to that level as well.
Absolutely. I think you both make such good points. And what kind of questions? Because sometimes you want to ask the questions to be informed, but you don't know what questions to ask. So as a somebody who's listening, who's a parent and is going through this debate in their mind and trying to figure out, is it safe for their community and their area and their children, what kind of questions could they think about asking from the schools and the teachers so that they can be better informed?
That's a great idea. I think the positivity rate really comes into it. I think having a dialogue with the school, a lot of schools are holding these town halls or these kind of Zoom webinars, and asking questions that really get into the details, because I think we can help the schools by asking these questions. And that's what I've found a lot of parents doing, is if we can think of the question like, oh, how is my child who has a disability, how are they going to be able to participate if that's what you want? And I'd like to know, what are some of the kind of resources that we have? And if it's not able to be done, do you have a backup? Right? Let's not push anybody into one way or the other and say, we're going to try and do it this way, but if we can't, we should have a backup system. And I think a lot of schools are thinking that way. And I think it's smart to think of, okay, let's start with online and then see how it goes. And then we have the capability of building in the hybrid model slowly. And I think that's smart, right? Because as we've all noticed, and in all of these different changes that we're doing, any change that happens, there's this J curve of change, right? Is we can all get used to new things. We can, but there is a period of time where everybody's adjusting, everybody's thinking of it in a new way. Everybody's having these questions that they need answered. Let's have that done in a reasonable way where we can get those questions answered and taken care of. Like, oh, do you have enough, nursing staff to do the temperature checks? Okay, and so what happens when a child has a temperature, and what are they kept in a separate room? Like, what are the protocols that are happening and being put in place so that we can prevent a school from becoming an outbreak source. And parents can really partner with the school districts to do that. That's what I would encourage. They need all the help they can get from us right now.
Sure. Dr. Stotts, do you have any thoughts?
Oh, I just go back to the basics of how can my child stay 6 feet apart? What happens if my child takes off the mask? What would be the things the interventions that would be taken in order, to make them safe? What is the access to soap and water and hand hygiene? Those basic things, you just have to have a clear understanding of what it is. And as a pediatrician, I love phones. I love videos. My baby's got a rash. Break out your phone. My baby's doing something weird. Break out your phone. So I think having families go to school with their kids and their phones, and then their kids can just show them what's going on, and they can see real time is probably the best way to get the monitor, and the feedback is like, are the basic fundamentals that will keep the virus from hopping from one person to another person able to be maintained? If they are, you've got a safe environment. If they're not, you need to, back up, back out, and take stock and figure out how to make it safe. So I kind of approach things like, if the ball is running to the curb and you can get it before you get to the curb, fine. But once it gets to the curb, whether it's going to get hit by the car or not is up to the ball. But, the child should not be out in the, all balls should stop at the curb. That's one of my rules in life. If I ran the world, that would be one of the things. That there would be no ice cream trucks. That'd be number 2. So, and then world peace would be number 3. So, I have my pediatric, what do I want? I think we just have to make sure that it's safe. What does safe look like? And then it's either safe or it's not. And if it's not, pull back and retool.
Yeah. I mean, there's so many decisions people have to make. What materials are we using? You can't have high touch environments in classes anymore. What's the number of people who should be in a room and can be in a room safely, and not going over that? Are there X's drawn on the ground where kids can stand? What are the bathroom facility rules? No more than one person in the bathroom. And, it just gets right down into the nitty gritty here of trying to determine safety. And so it's a lot of work.
Yeah, I mean, I think you mentioned not only, okay, our parents kind of juggling all of these different things of, is it safe? What about socially, friends? But then also the idea of work. Parents need to go back to work. Some parents can work from home, even though that has its own struggles, but some people can't. And that really there isn't another option for childcare. And trying to have a preschooler running around with friends with masks, I mean, that just sounds like a really challenging environment.
If we're going to do it safely, it means we're just going to have more resources and more protocols. For example, we do have a daycare at LACUSC, and a lot of the physicians use it. And just in the last couple of weeks, one of our pediatricians had to go and pick up her child twice because there was either an exposure or the child had just even one symptom that could have been something related to COVID, and they immediately asked the parent to come and take them. So a lot of parents may not have that capability, but as we're going into the school year, to think of who can be your backup, so one of the things that we're realizing during this whole pandemic is our networks. Our networks need to be strong and resilient, and we all need to have the ability to pull in family, friends, whoever to help us out here. The pods is an interesting concept that a lot of parents are doing as well, where they're just making sure that their children are socializing within a certain number of families, things like that. We're just all having to connect with our, resource group.
Can you guys talk about this idea of the pods and just explain it in for all of us to know what is a pod?
Yeah. For schools, both the CDC and the AAP have descriptions of pods in which it would be, a handful or a couple of handful, maybe, like up to 15 kids would be in one pod with one teacher, and they would interact amongst themselves, and there would be no cross interacting. So again, if one, member of the pod got sick or got quarantined, you were limited to that pod and not the entire school, where teachers would go from one classroom to another classroom to another classroom. And you can imagine how contact tracing in a school would be extremely challenging. So cohorting or using pods in the school is part of the formal plan for children. I don't think that we can rely on the fact that younger kids shed less, older kids shed more. The older you are, the more you shed. But if you shed on somebody who has a higher risk, the virus isn't picky. The virus is going to either land in something that's going to support its growth and replication, or it's not. And we want to provide environments where it is not, and that will allow it to no longer propagate. And that's the simplest understanding of what we have to do, is just disrupt this life cycle, and doing it in pods limits the the spread to the entire school.
Thank you for that explanation. I want to talk about parents if they develop symptoms suggestive of infection with coronavirus. How can they get treatment but keep their children and family safe if they're trying to take care of their kids in the interim?
I want to give a pitch for the LA County Department of Public Health, which has a marvelous website. And there's so many great resources at different levels of understanding and different levels of education. And my favorite posters and information that they have are the ones where they're multi-language and they're pictures, because I'm a pediatrician, so I like colors and I like shiny, I like bright. So I love pictures. And they have a tremendous resource on if somebody is sick, they have COVID, they go into isolation. What does that look like in the home, where they can isolate themselves in the home? The other people in the home would be a contact to them, so they would need to go into quarantine. And what does that look like? And there are phenomenal resources in 20 plus languages, and then but just the pictures. I love the pictures. So that's available for people to really get down, as Dr. Rahman was talking about, to the nitty gritty of what does it look like. If somebody is sick, or they're in quarantine, issues of, who's going to make food and how are you going to share the food. You don't share towels, you don't share toothbrushes, you don't share utensils, but you can use the same bathroom. So there are principles of cohorting, safely for isolation if you have COVID, or for quarantining in the home if you, just have an exposure, that can be done safely in the home if you have the resources to do so. If not, that's where the Department of Public Health has free housing for those who are not able to do that. And then looking again at children and trying to get more resources for the kids.
Thank you. That was very helpful. Do either of you, both of you, have any positive takeaways that you can share from this time? Any success stories or any special moments that you can recall?
Well, I love the fact that we've jumped forward in telemedicine and in televisits in exponentially. It's kind of like Star Trek. You know, last week we weren't doing it, and today we're like, oh, how many people do I have in my queue? I think that is marvelous. I think we should move towards healthcare delivered to the patient when the patient needs it and when the patient can pay attention to us instead of brick and mortar and come to the clinic. So I think that has moved the health field, you know, forward in ways completely unfathomable, you know, a few months ago. I also think that the concept of community and relying on each other has developed and bonded in no way, shape, or form, including things like, how are we going to teach our residents now that everybody can't be in the same room? And Dr. Rahman and I have bonded like twins in doing that. And so I have a soul sister, you know, and I already had one, but now I have one in a different level. That pushed us, you know, to do that. I also look at the success of other countries, which employ the fundamentals of social distance, masking, and hand hygiene. So it is completely doable, but we have to be able to do it. So it's all within our grasp. And so I think relying on ourselves in trying to perform the fundamentals, it's all within our reach. And that's
Absolutely.
a powerful thing. That's powerful.
Absolutely.
I think for me, it's this 2020 has turned into a massive learning experience on a global level, you know, as it has for everybody else, and to find the opportunities in there to help other people. I see so much positivity as well, so much that's happening that will ultimately make the world a better place. You know, I think resilience and remembering that, you know, that biology is beautiful as well as terrifying, but also we are all part of it. So we're all part of this web of life, you know. This is not something that fell out of interplanetary space. This is part of our spaceship Earth, and this is part of living here.
And the answer is knowledge and science.
Absolutely,
The
always.
true heroes, the answer is knowledge and science.
Yeah.
Well, I can't thank you both enough for your participation today. It has been a true amazing learning experience. And I want to thank you for all of the work that you both do and your department for our patients and for our community.
Well, thank you, Dr. Keshishian, for having these podcasts and reaching out to the community. I think it speaks highly of your department, but it really speaks highly of you, and we're so proud of you in these podcasts. So thank you so much.
Yes, thank you for this opportunity.
Thank you. Thank you both.